Hello everybody, this is Kumar Mohit, the student of medicine here at Jonelta Foundation School of Medicine, University of Perpetual Health System, Delta. So today I'm going to demonstrate in the series of the examination. First of all, we will go through the nose examination, then later we will go through the mouth examination, and the last one we will go through the neck examination. So before starting the examination, we have to know about the objectives of the examination. So what we are going to do, we have to go through the all three place of our body, and we have to just observe the color of the different structure. We have to observe the symmetry and the asymmetry of the structure. We have to observe the any exudate or any infection. That might be the oral infection, the nose infection, okay, and the different anatomical structure of the body, okay. So I'm going to demonstrate these all three examinations. So for that, I have with me Dubey Shambhavi. She's going to be my patient for today's video. So do I have permission to examine your nose, mouth and neck?
Yes.
Alright, thank you. So she have given me permission for that. We are going to demonstrate the first one, that's the nose examination. So for that, we have to go through the physical structure and the anatomy of the nose. So for that, we have to observe here, look at this, that the anatomy of the nose, here is the bony part, that's the 1/3 of the nose, and then lower one is the 2/3 of the nose, that is the cartilaginous part. We have to observe the arch of the nose, and we have to just palpate near to the nose as well, that there should be no any tenderness and the lumps near to the nose. And we know that this is the nose tip, and these are the nares, the two nares. So here this is the nasal septum that's dividing the nose into the two parts, and we have to observe the symmetry from the outside, that the symmetry of the nose properly, and then we have to observe the internal structures. While observing the internal structure, we have to note that the vestibules of the nose, the anterior part of the vestibules, they have the hairy structure, and when we go to the middle part, then it would be a mucous membrane. So okay, and when we are going in the deep examination of the nose with the help of the otoscope, then we have to put this otoscope inside the nose. So for the proper examination, we have to just press nose tip a little bit, press it gently, and then we have to observe the vestibules, and observing the internal structures of the nose, we will able to just appreciate that the inferior turbinate and the middle turbinate. We have one more turbinate, that is the superior turbinate, but we will not able to just see that the superior turbinate. So we will just see the inferior turbinate and the middle turbinate. We have to just see is there any exudate or any swelling inside the turbinate, and the lowering structure from the interior turbinate, inferior turbinate and the middle turbinate are the meatus, different meatus, like the lower one is the inferior meatus and the middle meatus. So we have been observed the different kind of the meatus, and we didn't find any kind of the exudate or any kind of the infection, or we have been observed the color of the mucosa of our nose. Then we have seen that the mucosa of the nose is a little bit more pinkish or the reddish as compared to the oral mucosa. So we have to make sure that we know this point so that we can observe it properly. And there was no any infection, there is no any exudate inside the nose, so that was the properly and the fine what we have been observed. With that, we have to observe the sinuses, and we have to palpate the sinuses. We have to observe, just figure out is there any tenderness or any deformities in the sinuses, in the exudate in the sinuses. So this was the frontal sinuses, and this one are the maxillary sinuses. We have to palpate it properly and figure out for some deformities or some lumps. So we have been observed there was no any lumps, no deformities in the sinuses, no exudate, no fluid in the sinuses, so that was the fine. So that was for the nose examination. For the next examination, we are going to demonstrate you how to examine the mouth. So for that, we have to observe the external structure of our mouth, and before that, if your patient have been applied lipstick, then please instruct them to remove that first. And then go through the external structure of the mouth, observe the symmetry of the mouth, observe the lips, what we can see from the outside, and the color of the lips. Is there any scales on the lips or not? Is there any deformities in the lips? So we have to mainly go through the symmetry. We have to observe the external, the area around the lips as well. Is there any lumps or something around the lips? So go through the inside the mouth now. So will you please open your mouth, okay, and observe the gingiva, the color of the gingiva, the mucosa. And the color of the gingiva may be different in the different color skin tone people. Like in darker color skin tone people, the gingiva color may be a little bit diffuse browny, and in the light skin color people, the color may be, gingiva color may be a little bit more pinkish. Okay, so we have to observe the gingiva. We have to observe the upper gingiva as well, and observe the teeth, because we are going to do the complete mouth examination. So we have to observe the teeth as well, and the gingiva, the terminal part of the gingiva. Is there any exudate or any redness or the color differentiation in the gingiva? So we have to notice that all points. Okay, now we are gonna more deep in the mouth. So we have to, will you please open it again? We have to observe the walls of the mouth, observe the color. Is there any infection? And will you please protrude your tongue? Okay, we have to just observe the color of the tongue. Sometimes it's a little bit pinkish and the whitish, so it's fine. But sometimes we have the infection on the tongue, so it may be dangerous. So we have to observe the color of the tongue. We have to observe the will you protrude it out again? So we have to observe the color of the tongue properly. We have to just palpate the, will you please let it be a little bit more out? Okay, we have to just feel, is there any lumps or any deformities in the tongue properly? Just check it. And then we have to observe the lateral part as well. Will you please protrude it more? Okay, the color is fine. It's a pinkish and a little bit whitish, so it's all right. And for the more and the deep observation of the tongue, we have to use this square gauge pad. So we have to hold the tongue with this, and to see the surrounding structure, we have to move the tongue. So protrude the tongue out. Okay, now we have to open the mouth properly. So we have to see the lower structure properly. Okay, so we have to observe it properly, because sometimes it's happen like we have some infection, because sometimes our oral mucosa have some infection, so it might be just give some inflammation or some exudate, some liquid is coming and changing the color of the mucosa around the tongue. So we have to observe it properly. So that was that one. Now we have to go more inside the mouth. So open it properly. Now we are going to observe the the tonsils, the lateral pillars, the anterior and the posterior pillars, and then uvula we will observe, and the pharynx at the last. So let's go and observe that. So will you please open it properly? Open it and protrude your tongue out, okay, properly. So make sure if the tongue is obstructing your path, then we can use the tongue depressor. So here the tongue depressor. So to observe the internal structure of our mouth, we have to use that. Will you please open it? Flex the, okay, and we have to observe the, okay, uvula and the pharynx, tonsils, the anterior and the posterior pillars, and then we have to tell our patient to just say ah. Okay, you just say ah for me. So look at this, please. Look at this. Say ah for me. So we have to observe the the movement of this uvula and the symmetry of that one. While we are saying ah, then this uvula will be lift up, and we have to observe the symmetry. Okay, so movement of this one. So that's the observation of this one. So in mouth examination, we have been observed that all the mucosa of the mouth, and then we have been observed the tongue, the pharynx, and that all structures. And mostly we have to observe the any exudate or any lumps or any deformities inside the mouth. So that's it for the mouth. So now we are going to examine the neck. So as we know that we have the very important structure in the neck, like thyroid gland. So especially we are going to examine the thyroid gland. Then we're gonna observe the nodules, different nodules in the neck, because we know whenever we have the infection, then first of all that infection go through the nodules of our neck. So we have to observe that whole structure. Okay. So for the neck examination, we have to know about the external structure of the neck. We have to go through the anatomy of the neck. So as we know, we have the hyoid bone here on the uppermost part of the neck, and then we have the thyroid cartilage here. Then we have the cricoid cartilage lower to the thyroid cartilage, and then we have the thyroid gland somewhere over here. We have to palpate the thyroid cartilage and the thyroid gland and all structures properly. And for the good observation of the thyroid gland, we have to tell our patient that please swallow the water. So for that, will you please have water and hold it, and whenever I'll say you to swallow, then swallow it. So okay, now swallow. So as we have been observed, while the patient was swallow the water, so at that time the movement of the thyroid gland was we can see it properly. So we have to just observe. So somewhere over here, palpate it properly, and look at this. That is there any lumps or any deformities in that. So for the better observation of the thyroid gland, the neck examination, we have to go to the back of the patient, and then we have to observe it properly. So let's do it. So for that, we have to just put our fingers here on the thyroid lateral side of the thyroid gland. Look at this, and then palpate it properly. We have to displace the trachea a bit from their place, and we are going to displace it in the right side, because we are going to palpate the right lateral side of the thyroid gland. And okay, I got that. And now displace the trachea towards the left side to observe the left lobe of the thyroid gland. We have to observe it properly. In some case, it may be happen that we will observe that the enlargement of the thyroid gland, but if we will observe that, then we have to auscultate it and figure out for the brio sound, and that sound is non-cardiac murmur sound. I repeat, non-cardiac, it's not related to the heart. So okay, so we have to observe that if our patient have enlarged thyroid. Put the stethoscope at the lateral side of the thyroid and then check for the both side. Okay, so that was for the thyroid examination. So after that, we have to go through the examination of the different nodes and the glands in our neck. Like we have the salivary glands, the parotid gland, and the mandibular gland or the maxillary glands of our salivary system. Okay, so we have to observe the, and we have to observe the, is there any lumps or the tenderness. So this one is the parotid gland, maxillary gland. Go for the submandibular gland, palpate it properly. Now we are gonna to examine the different kind of the nodules. for the nodes. So first of all, we will start from the pre-auricular in front of the ear, palpate it, go for the post-auricular behind the ear, then go for the occipital node, and then come in front and go for the tonsillar, submandibular, submental node. Okay, then go down and observe the superficial cervical, go for the posterior cervical nodes, and then the deep chain cervical. So we have to palpate the all nodules because whenever we have the infection, the first of all infection go through these nodules. Okay, so is there any lumps, is there any size deformities, is there any tenderness in these nodules? Then we have to just figure it out, and then we have to go for the other diagnosis. Okay, so that was the complete neck examination. So we have been observed the nodules, so that was the complete neck examination. So we have been already done with the nose examination, then mouth examination, and that was the neck examination. So that's all from my side. Thank you so much for watching this. Have a great day.